In recent weeks, Thailand has witnessed the return of COVID-19 with a notable increase in reported cases across several provinces. This development marks a shift after a lengthy period of relative calm, raising new questions and concerns for residents, travelers, and health professionals alike. Although the overall threat level appears lower than during previous surges, understanding the current situation and what it means for everyday life is essential. Let's explore what's happening, which precautions are most important, and what steps both individuals and communities can take to stay safe. Since early May 2025, health authorities have tracked a gradual but consistent rise in COVID-19 cases. Hospitals in cities such as Bangkok, Chiang Mai, and Phuket have observed more patients presenting with respiratory symptoms. Most of these new cases have been linked to the Omicron subvariant XBB.1.6. This particular version of the virus is known for its ability to spread efficiently from person to person, but it tends to cause less severe illness than some earlier strains, such as Delta. Daily case numbers, while not reaching the heights seen in past years, are still enough to place a renewed focus on public health habits. Recent weeks have seen hundreds of new infections reported each week in the busiest areas, and while most cases remain mild, some vulnerable groups are still at risk of more serious outcomes. Doctors and public health officials are especially concerned about elderly individuals, those with underlying conditions such as diabetes or heart disease, and people with weaker immune systems. These groups have a higher chance of developing complications if they contract COVID-19, even in its milder forms. So what should you look out for if you suspect you or someone you know may be infected? The symptoms seen in this current wave are broadly similar to previous bouts of Omicron. Most people experience fever or chills, a persistent cough, sore throat, fatigue, headaches, and nasal congestion. Some may also report muscle aches or a general sense of feeling unwell. For the majority of healthy people, these symptoms stay mild and improve within a few days to a week. Many recover fully without needing special treatment or a hospital stay. However, anyone who experiences difficulty breathing, chest pain, confusion, or a high fever that will not subside should seek medical attention promptly. Hospitals remain open and able to help those with severe cases, and early intervention can be crucial for recovery. Given the current landscape, what actions is the Thai government taking to address this renewed wave of COVID-19? Authorities have made it clear that they do not plan to reinstate strict lockdowns or widespread travel restrictions at this time. Instead, the focus is on reinforcing proven preventive measures, particularly in high-risk settings. The Ministry of Public Health is strongly recommending the use of face masks in crowded indoor spaces, including on public transport, at busy markets, and within hospitals and clinics. Public places, such as shopping centers and entertainment venues, are also being reminded to maintain good ventilation and encourage mask usage where social distancing is difficult. Employers and schools are receiving guidance to be flexible with attendance, ensuring that anyone feeling unwell can stay home without penalty. This not only protects other students or colleagues, but also helps break the chain of transmission. Routine cleaning of shared surfaces, handrails, and doorknobs is being encouraged, and signage about hand washing is once again common in public washrooms and high-traffic areas. A key pillar of Thailand's response remains the ongoing vaccination campaign. While the initial rush for COVID-19 vaccines may have slowed, booster shots are now widely offered, especially to those in higher risk categories. Health experts are advising anyone who has not received a COVID vaccination or booster in the past 6 months to get a shot as soon as possible. Vaccination remains one of the most effective ways to reduce the risk of severe illness or hospitalization. With supplies widely available through hospitals, clinics, and mobile outreach units, there is little reason to delay. For individuals wondering how best to protect themselves and their communities, the core preventive measures are simple yet highly effective. Start by wearing a well-fitted face mask in places where maintaining physical distance is tough, such as shopping malls, subway cars, buses, and crowded indoor gatherings. Hand hygiene is equally important. Regularly washing with soap and water, especially after being in public places, helps eliminate viral particles that might linger on your hands. If hand washing is not practical, using a hand sanitizer with at least 60% alcohol is a good alternative. Avoiding close contact with people showing symptoms of illness helps reduce your risk. If you begin to feel any flu-like symptoms yourself, minimize contact with others, rest at home, and monitor your health. Most importantly, if you develop worrying symptoms, such as shortness of breath or a high persistent fever, do not hesitate to seek medical advice. Ventilation plays a vital role in keeping indoor spaces safer. When possible, open windows and doors to allow fresh air to circulate, especially during gatherings or meetings. Many businesses, restaurants, and offices are taking the extra step of investing in air filtration systems or ensuring that air conditioning units bring in outside air. Community support is also crucial during a public health challenge. Looking after elderly neighbors or those who might have trouble accessing healthcare or vaccination services is a meaningful way to reduce risk for everyone. Sharing trustworthy information and encouraging one another to stick to preventive measures can make a significant difference. At this stage, there is no reason to panic or revert to the restrictive lifestyle seen in the early days of the pandemic. However, complacency can increase risk, particularly for the most vulnerable members of society. By staying informed and adopting a few common sense habits, everyone can play a part in slowing the spread of COVID-19's current subvariant. The situation reminds us all that even as the virus evolves and becomes less severe in many cases, it continues to present new challenges. Ongoing research, vaccination, and collective vigilance remain our most potent tools. Whether at home, at work, or out in the community, taking a few small precautions can have a big impact on public health. As Thailand faces this new wave, let's maintain a calm, practical approach. Get vaccinated or boosted if you are due. Keep up with hygiene routines learned during earlier stages of the pandemic. Look out for signs of illness in yourself and in those around you. Above all, show patience and understanding. Together, these efforts will help Thailand manage COVID-19's return and keep life moving forward with confidence and care.